vitamins. To start with vitamins, they are defined as organic molecules that serve a wide variety of functions in body structure and metabolism. These compounds are essential as they are not synthesized by mammalian cells and therefore must be supplied in the diet. And except for niacin, which is considered as a semi-vitamin as it can be synthesized in mammalian cells from the amino acid tryptophan. Vitamins are released from their food sources by digestion and become available depending on the type of food and agents that may chelate these compounds. Fat-soluble vitamins are absorbed in the lipid micelles after fat digestion, but factors that hinder fat absorption also affect the absorption of fat-soluble vitamins. Water-soluble vitamins and most mineral salts are absorbed from the small intestine either by active transport or carrier-mediated diffusion. We have one of the water-soluble vitamins, which is vitamin B12, and its absorption requires a specific transport protein named the intrinsic factor, which is a small glycoprotein secreted by the parietal cells of gastric mucosa. As mentioned in the introduction, we have two groups of vitamins, the fat-soluble vitamins and the water-soluble vitamins. Both groups differ in some intrinsic characters that will be discussed later. For all vitamins, we are going to describe their role and mechanisms of their actions, and also describe the manifestations of their deficiencies. We start with the fat-soluble vitamins, which is a group of 4 vitamins, vitamin A, D, E, and K. First, we start with vitamin A and vitamin A sources. Sources of vitamin A are animal and plant sources. Vitamin A or retinol is present in meat, liver, egg, and fish liver oil. The provitamin beta-carotene, which is a precursor of vitamin A, is present in plants like carrots, and it forms retinaldehyde. So, the retinoids or forms of vitamin A, and before we discuss these forms, we have the beta-carotene and other provitamin A carotenoids that are cleaved in the intestine by an enzyme, which is a carotene dioxygenase. And this cleavage yields retinaldehyde that is reduced to retinol. Retinol is then esterified and secreted in chylomicrons together with esters formed from the dietary retinol. So, the chylomicrons, which is one of the lipoproteins, serve as a transporter of retinol as one of the fat-soluble vitamins. We have 3 forms of vitamin A which are important for health. We have the retinal, retinoic acid, and retinol, which is a key player that can be converted to other forms. As mentioned before, that we have three forms of vitamin A, which are retinol, and retinoic acid. But the parent structure is a provitamin A or carotene, which is converted to retinol inside the body. Beta-carotene is a carotenoid or pigment and present in yellow and orange foods and is a potent provitamin A. And as we mentioned before, the sources of vitamin A or retinol is present in meat, liver, egg, and fish liver oil, and the provitamin beta-carotene is present in plant sources like carrots and is responsible for formation of retinal height. The main functions or roles of vitamin A in the body. First of these functions is that it promotes the process of vision and visual cycle. In the retina, retinaldehyde functions as a prosthetic group of the light-sensitive opsin proteins, forming compounds known as rhodopsin in the rod cells and iodopsin in the cone cells. So, these structures are responsible for converting the light energy into nerve impulses. Another structural function for vitamin A is that it is responsible for maintenance of the corneal epithelium, and its deficiency leads to a problem known as xerophthalmia. The second rule is that it participates in protein synthesis and cell differentiation. It supports reproduction and growth and supports immunity. It also has a role in bone growth and remodeling, combined with vitamin D and other vitamins like vitamin C. Is responsible for sense of some types of glycoproteins, and the beta-carotenes have an antioxidant activity. To continue with the vitamin A functions, we first mentioned that vitamin A has a role in the visual cycle. As in the retina, retinaldehyde functions as a prosthetic group for the light-sensitive proteins. Opsins, forming rhodopsin in the rods and iodopsin in the cones. The antioxidant activity of vitamin A represented by the beta-carotenes, which are compounds that can dispose of free radicals and reactive oxygen species by scavenging them and suppressing their effect or opposing their actions, and so are referred to as one of the antioxidants like vitamin C and vitamin E. Beta-carotene is only an antioxidant at low concentrations of oxygen, but at higher concentration of oxygen, it is an autocatalytic or pro-oxidant. This means that its effect is reversed when the oxygen concentration is elevated. And as you see in the figure, that beta-carotenes can combine with molecular oxygen and form beta-carotene endoperoxides and epoxides. So they can dispose of or scavenge the reactive oxygen species. The deficiency of vitamin E is manifested as a deficiency of all the functions it supports. First of these, its effect on the eye. The first effect is known as xerophthalmia, which is dryness of the cornea and the conjunctiva. And xerophthalmia is an ancient Greek expression where xeros means dry and thalmos means the eye. So the whole expression is a dry eye, and is a medical condition in which the eye fails to produce the tears, which humidifies and moistens the cornea and conjunctiva, and moistens the eye and prevents drying. And this occurs due to keratinization of the lacrimal duct, and this leads to its obstruction with no tear production. Also, this dryness leads to conjunctivitis and inflammation of the cornea and increased epithelialization or keratinization. And vitamin E is one of the causes of the problem of xerophthalmia. Also, dry skin. The skin looks like the goose skin. And as mentioned, that it has a role in the visual cycle, so vitamin A deficiency leads to what is known as night blindness, which is a cause of blindness, of course, in the third world countries. For its deficiency in regarding the female and male reproduction, as we mentioned earlier, it has a role in reproduction and protein synthesis and cellular growth and differentiation. So the vitamin A deficiency is associated with increased incidence of abortions and neonatal death. Also some congenital malformations. In males, the vitamin A deficiency is manifested with keratinization of testicular epithelium and infertility. Also, there is increased incidence of infection that may occur in the respiratory tract due to roughness of the mucosa. In the urinary tract, this is also the case. And for bone and teeth, there is delayed growth and maybe some abnormal skeletal development. Deficiency of vitamin E is manifested for the cell as a whole by deficiency of the antioxidant activity, and it may lead to a development of cancer. The requirements for vitamin A in adults, adult needs about 5,000 international units, which increase in pregnancy and lactation to about 7,500 100 international units, and the international unit is equivalent to 0.3 micrograms of vitamin A. For the fat soluble vitamins, toxicity is a high risk when the persons or patients administer large doses of these vitamins. For the vitamin A toxicity, there is only a limited capacity of the body to metabolize vitamin A, and excessive intakes lead to accumulation beyond the capacity of intracellular binding proteins, and the unbound vitamin A may cause membrane lysis and tissue damage. And as you know, that the fat-soluble vitamins may be combined with proteins or lipoproteins and may be stored in fatty tissue. So the symptoms of toxicity may affect the central nervous system and manifested as headache, nausea, ataxia, and anorexia, and may be associated with increased cerebrospinal fluid pressure. In the liver, there may be hepatomegaly and some histological changes, as well as hyperlipidemia. Calcium homeostasis also affected. Calcium homeostasis is also affected. There is thickening of long bones with hypercalcemia and calcification of soft tissues. And the skin, as we mentioned, becomes dry with excessive dryness and desquamation, and maybe loss of hair or alopecia. Other manifestations may occur depending on the extent of toxicity and the dose that the patient administered. And this ends this brief discussion about vitamin A. You can find information or more information about this lecture and other lectures at this website. Thank you.